Okay, today we're going to work on the joint capsule of your shoulder. We're going to work in an external rotation base, and we're going to do isometric contractions to help open up space within our active and passive range. And this is going to strengthen through there, but also open up that space that our shoulder needs to create deeper healing and room for that rotator cuff. So first of all, laying face down, bring the blocks into this position, about 90 degrees is where we want to be. And then let's work out where our active range is. So we just externally rotate, and okay, my active range is about here. So what I'm going to do is I need to get into my passive stretch. It's because that's where we want to work and do our isometric contractions. So here is my stretch. I'm going to place my forehead on my hand, and I'm going to set my timer for 2 minutes. It takes about 2 minutes for our nervous system to really, and our tissues to really settle and get into a good place with this stretch. So we're going to wait for 2 minutes before we do our isometric contractions. Our isometric contractions, the first one's called a PAILs contraction. That's with me doing this movement into the blocks, but I'm not going to be moving my joint. It's going to be isometric, so I'm going to be pushing my hand into the block like so. My next contraction is going to be a rails contraction, and I'm going to be trying to lift my hand off the block. I'm not going to be moving, but I'm going to be contracting the muscles to lift my hand off that block. It's going to be a hard one. The rails contraction is the more of a difficult one. Sometimes you can feel a bit crampy in this one because we have no neurological control here, because we don't usually use our shoulder or actively use this range. So it can be a difficult contraction. So if it does feel a bit crampy, just back off that contraction. The contraction that we're going to do is going to be in the pain-free range. It's going to be best effort, but a safe contraction there. So we're coming up now to a minute 30, which has got another 30 seconds. After that 30 seconds, I'm going to be pushing into that block for 15 seconds. And then I'm going to go opposite way, trying to lift my hand off the block for 15 seconds. So let's do that now, just resting into that stretch, really nice and relaxed. Breathing into it. Got another 10 seconds here. Okay, 3, 2, 1, and contract. And I'm pushing into the block as hard as I can, 20%, 30%. Best effort now. I'm pushing into the blocks. 5, 4, 3, 2, 1, and opposite contraction. I'm lifting my hand off the blocks, trying to contract the muscles to externally rotate my shoulder. Push and hold. Keep going, keep going. Excellent. And 3, 2, 1, and relax. Okay, so now we set the timer for 45 seconds. We're going to remain in this position for 45 seconds. Really try and get the best possible stretch, the new stretch that we've got after doing those contractions. And just let the nervous system allow us to get into that extra range and extra stretch there. So this is a 45-second stretch, and we're going to do our PAILs and rails contraction again. So coming into counting down. 5, 4, 3, 2, 1, and contract. I'm pushing into the blocks as hard as I possibly can. The best effort, but a safe contraction. And pushing, really pushing as hard as I can. Now I'm going the opposite way. Lifting my hand off the block without moving it, but contracting the muscles into external rotation. Excellent. Keep going, keep going. 5, 4, 3, 2, 1, and relax. Okay, now we set the timer for another 45 seconds there. really relaxing into that stretch. That contraction there, it's really got to be pain-free, no pinching or sharpness. It's got to be a really safe contraction, but try and make it your best effort. You want to really work hard for this. It'll work hard for that healthy joint. We really want to put that stress in it so that we can make changes to those tissues. Now, what we're going to do now is after the 45-second stretch, we're going to start going into our lift-offs, which is starting to just switch on the muscles in our new range of motions that we've just achieved. So 45 seconds there, we can stop the timer. Coming into this position here, and we're going to just lift off the block here like this. 10 contractions, really nice and slow and controlled, trying to really contract as far as we can and squeezing that external rotation there. So 6, 7, 8, 9, and on the 10th contraction, we're just going to hold it there for 15 seconds. Keep going, keep going. 5, 4, 3, 2, 1, and relax. Okay, so now we just slowly get out of this base. You will feel like you've done a really deep stretch, and you'll feel like you need to move your shoulder a little bit. If it feels like that, you've done this exercise properly. You've really worked deep into that joint capsule and getting that movement and function back to that joint. And these exercises are really powerful exercises to heal a joint. So give it a go. But that's how we do a PAILs and rails, capsule stretch for that shoulder.